Welcome to an overview of Medicaid documentation for behavioral health practitioners. As a behavioral health practitioner, you are in the business of helping your patients. Patients are your priority. Meeting ongoing patient needs, like providing and coordinating necessary services, is impossible without documenting each patient encounter completely, accurately, and in a timely manner. Documentation is often the communication tool used by and between professionals. If records are not properly documented with all relevant and important facts, it can prevent the next practitioner from providing sufficient services. The outcome can cause unintended complications. Another reason for documenting medical services is to comply with federal and state laws. These laws require practitioners to maintain the records necessary to fully disclose the extent of the services, care, and supplies provided to beneficiaries, as well as support claims billed. In addition, proper documentation can help protect you from challenges to furnish treatment and civil, criminal, and administrative penalties and litigation. Behavioral health services must meet specific requirements for reimbursement. Documented services must meet that state's Medicaid program rules, reflect medical necessity, and justify the treatment and clinical rationale to the extent required under state law. Remember, each state adopts its own medical necessity definition. Reflect active treatment to the extent required under state law. Be complete, concise, and accurate, including the face-to-face time spent with the patient. For example, the time you spend completing a psychosocial assessment, a treatment plan, or a discharge plan. Be legible, signed, and dated. Be maintained and available for review. And be coded correctly for billing purposes. Here are some things to avoid as a behavioral health practitioner. Never bill chance momentary social encounters between a therapist and a patient as valid therapeutic sessions. Never bill undocumented services. Never bill services coded at a higher level than those provided. For example, if providing group therapy, be sure and bill group therapy codes rather than individual therapy codes, and document patient-specific information in each attendee's medical record. As a behavioral health practitioner, you have specific responsibilities when you accept reimbursement from a government program. You have a duty to ensure that the claims submitted to federal healthcare programs are true and accurate, and that your medical record documentation supports and justifies billed services. All practitioners' documentation is open to scrutiny by many, including employers, federal and state reviewers, and auditors. You can protect yourself and your practice by implementing an internal self-auditing strategy. There are 5 basic self-audit rules you can use to get started. Develop and implement a solid medical record documentation policy. Make sure the policy covers meeting federal and state Medicaid regulations. The policy should address what actually happens in everyday practice. Develop or use one of the available standard medical audit tools. The tool should cover the documentation policy criteria and coding standards as part of the review. Choose a staff member who understands documentation and coding principles to select a random sample of records for a specific time period. Have someone else audit your charts. Removing bias is important. For best results, make the audit as realistic as possible. Use the self-audit results for improving practice compliance. There is no real value in conducting a self-audit unless discovered issues are resolved. Electronic health record self-audits require similar methods, but their unique nature necessitates extra precautions. Make sure autofill and keyword features are turned off. Watch for cloned notes that appear identical for different visits, as these may not reflect the uniqueness of the encounter or the patient's description of their chief complaint. Make sure all notes have a date and timestamp, even when updating patient history and life events. Distinguish notes entered at different times through clear punctuation or spacing. Make sure any edits to the patient's record are also initialed or identified with the person making the edit. Properly filed claims are the responsibility of all behavioral health practitioners. You can be culpable if you knowingly participate in fraudulent activities or know of illegal activity and do nothing. Healthcare laws carry heavy penalties for offenders. Penalties can be administrative, civil, and criminal. If you are aware of or suspect fraud, waste, or abuse, report it to the authorities. Reducing Medicaid fraud has several significant benefits. Cutting down on fraud can save billions of dollars that would otherwise be wasted. These funds can be redirected to provide more services or improve the quality of care for eligible beneficiaries. A reduction in fraud strengthens the overall integrity and reliability of the Medicaid program, ensuring that resources are used appropriately and efficiently. By preventing fraud, more resources can be allocated to legitimate healthcare services, improving access to care for those who genuinely need it. With fewer resources siphoned off through fraudulent activities, there's a greater focus on delivering high-quality care, which can lead to better health outcomes for Medicaid beneficiaries. Reducing fraud ensures that all beneficiaries receive the services and benefits they are entitled to, fostering a more equitable distribution of resources. When fraud is minimized, the public has greater confidence in the Medicaid program's ability to effectively serve those in need, enhancing overall trust in the healthcare system. Combating fraud requires significant administrative effort and resources. By reducing fraud, these resources can be better utilized for patient care and program management. Effective fraud reduction helps ensure compliance with laws and regulations, reducing the risk of legal repercussions and associated costs for the government and healthcare providers. Thank you for watching this Medicaid documentation for behavioral health practitioners video. Please consult the companion materials as your reference guide.